Hello, everyone. It's Monday, April 26th, and you know, it's surely a good day in a lot of ways. The sun's shining, and it's beautiful outside. It's surely beautiful in West Virginia. It's not so beautiful for 8 families. We've lost 8 people over the weekend, and like I said, sometimes this is a little late on reporting, but this is considering where we've been, it's a good number, and we want these numbers to continue to be at this level or less and less, and finally we'll get to 0. You know, I promised you some things, you know, in regard to what we're going to do to try to amp up our vaccination process and everything, and I'll get to that in just one second. But let's be very respectful and keeping these folks in your prayers, your thoughts. Don't let these families feel alone. Our 2,814th death is an 81-year-old female from Cabell County. Our 2,815th death is a 69-year-old male from Monongalia County. Our 2,816th death is a 45-year-old female from Berkeley County. Our 2,817th death is a 66-year-old male from Marion County. Our 2,818th death is a 63-year-old male from Raleigh County. Our 2,819th death is a 43-year-old male from Raleigh County. Our 2,820th death is a 73-year-old female from Raleigh County. And our 2,821st death in West Virginia is a 78-year-old female from Kanawha County. We lost 2 young people right here, and we lost a lot of people here that still had lots and lots and lots of life in front of them. You can't ever, ever let these people become just a statistic. We don't want to grow dull to the fact that these are great West Virginians. We're losing a part of our wisdom, and absolutely, please, please keep them in your prayers. We didn't test a lot over the weekend, and our daily positivity rate was way up at 6.82. We had 289 new positive cases. Our cumulative positive still holds steady at 5.18. Our active cases are down just a teeny bit at 7,157. Our recovered cases are 141,693. Our hospitalized are 260 and 85 in the ICU units, and we have Raleigh and Berkeley counties still in the red. Reminders from me, as I've done many, many times, especially if you're 65 years of age and older, and you get any kind of unusual feeling, that is a sniffle or a, headache or tiredness or any level of anxiety, please just go get tested. If we can catch this early enough, these antibodies will shut it down. You saw that with our president Donald Trump. Absolutely, you saw this happen with him. It'll shut it down if we can catch it early enough. I want to tell you again that the J&J, the Johnson & Johnson vaccine is, we have resumed administering Johnson & Johnson in West Virginia. They brought it back online, and there is a warning on the label, but for the most part, they feel like the risk is absolutely so minuscule in comparison to the benefits. So nevertheless, Johnson & Johnson, we're back in business there. From the standpoint of our vaccine eligibility, we have talked many times about our vaccine eligibility, and we are age 16 and above in West Virginia. Now, I want to just stop right there, and I want to go through just some ideas of things that we have decided we can do. We have vetted this process through the entire thing. One of the things that we know is happening right now is we know for sure that kids 16 all the way up to 35 years of age are having a real transmission issue with this disease. We can't get kids across the finish line with this. And so there's lots and lots and lots of ways to get there. I truly believe that the good ideas that I come up with are coming from the good Lord, as I've said many times, and I'll take credit for the bad ones. But I do believe this is a good one. Our kids today don't really probably realize just how important they are in shutting this thing down. But let me just go over just a couple of things. I'm going to go back to my little whiteboards here and everything, and I hope maybe you can see this blue a little better. Okay, so now we know of the eligible population. We know there's 1,470,000 people that is our eligible population. This is the number that we have to focus on right now. Now that number is 16 and above in the state of West Virginia. 1,470,000. Today, we have vaccinated 52% of this. Now, just to tell it like it is, if we continue on the path of 52, and then at some point in time we'll get to 53 or 4, and then it'll be tougher and we'll get to 55 or 6, what's going to happen then is every other day when Jim walks in here, he's going to be reading names. There's no way around it. And also, we're going to be faced with wearing these masks that nobody likes for a long, long, long time. Now, we got to do something about this, don't we? Now, I am telling you that if you'll just stay with me, this is today. This is today. Right there is today. Now, stay with me just a second. Can y'all see all this, Jordan? Okay. Everybody's got this. All right. In our program, I got to have something to wipe with, you know. Just toss it. Okay. In our program, now, if you'll just let me just bear with me just 1 second here. Hope we don't lose this. Okay. In our program that we called 588 beat 588 ... bad. Now, how did we get to 588? Where did 588 come from? Here's where 588 came from. It's so simple. If you'll take 1,470,000 people that are eligible to take the shot today times 40%. Times 40%. Now, that's the same as this. It's just in a decimal there. That comes down here and equals 588,000. Now, again, we fear, Kenny Bass brought it to our attention, we fear that 40% of our population may decide we don't want to take the shot. We just aren't going to do it. And if that be the case, we've got 588,000 that are sitting on the sidelines and they're not taking the shot. We've got to do something about this. We've got to beat 588 bad. So, let me just stay with me. It won't take just another second. I'm having all kinds of trouble here. Now, of our kids that are 16 to 35 years of age, this number right here is somewhere really, really, really close to 380,000 people. That's what this number equals. They're not taking the vaccines as fast as we'd like them to take them. So, there's all kinds of different giz-whizzes that you can do, and you can go to the schools, you can do this, you can promote, Jim Justice can talk to you, all that kind of stuff. You can do things like grand prizes and giveaways and whatever it may be. We have vetted this through and through. Now here's my idea. My idea is especially our young people today. This country is the greatest country on the planet. West Virginia, the greatest state in the nation. West Virginia, the state that led our way over and over and over. We don't want to stop yet, do we? So at the end of the day, we continue to do more. So with this great nation and with this great state and with our young people that can always stand an extra dose of patriotism, instead of trying to come up with a way that is truly going to motivate them and us get over the hump, we are announcing today, and we have vetted this every way that we possibly can to be assured that we can use CARES dollars to do exactly just this. We're going to give every single one of these people, the people that have already stepped up, our young people that have already stepped up and been vaccinated, and every single one of our young people, we're going to give a $100 savings bond to every single one that steps up and takes their vaccines. Now, to me, let me just show you how valuable this is to us. If 80% of this number right here, that's how many there are. If 80% of this number steps up, that number is going to turn into something around the neighborhood of 275,000 people that will take the vaccine. If 80% of this number, or 78% of this number, stands up and takes a vaccine, that's your number. Now let me show you what happens. Let me show you, because we're going to continue to vaccinate our elderly and everybody on the sun. But if we want to really move this needle, and we want to move it right now, you got to make a decision. You got to make a decision. You've got CARES money. We have vetted it every way in the world. I have said it 1,000 times over. We have got to get to a situation to where we shut this thing down. We stop it. We stop it dead in its tracks. And if we stop it dead in its tracks, these masks go away, the hospitalizations go away, the death toll and the body bags start to absolutely become minimal. We got to shut it down, West Virginia. That's all there is to it. So therefore, what I'm doing is I am stepping up and I am calling on all of our kids, all of our young people that are 16 years of age up to 35. Accept that wonderful savings bond, and I hope that you keep it for a long, long, long time. I hope that it signifies to you just what this great country is all about. Because at this time, you are stepping up to shut this thing down. Now just stay with me one more second, because I'm a math guy. I showed you just a second ago, if you'll remember this number, 275,000. And let me show you what happens. And I've got permanent ink on the board. So that way you'll absolutely be able to permanently remember this. Okay. Okay. I love it. All right. If you've got today 1,470,000 population, and we've got 52% vaccinated. Berkeley, give me that number exactly. I think it's 767,000 vaccinated. Now, if we're able to be as successful as I'm talking about with the 16 to 35-year-olds, that's 275,000 more. Now look what happens. When you add them together, you've got 1,042,000. Now, take 1,042,000 and divide it by 1.47 million. 1,042,000, because that's how many you'd have vaccinated if we get this 275. That's 71% of our total population. All of our health experts, all of them, have said over and over and over that if we can get to 70 right here, if we can get to 70 right there, we'll shut this thing down. All I can go by is the advice of our medical team and our experts. Now, this number will change because our population in the state of West Virginia is 1,793,000, but this is all that's eligible today. This number will change. And so if that number does change and we're going to vaccinate from 12 on up, that number will go up a little bit. And what will have to happen is if we get 275,000, we'll have to get a small amount of our other folks, the elderly or whomever it may be. Now, I'm telling you, it's time, West Virginia, to shut this thing down. If we want it to just linger forever, then there's a way. All we got to do is have all of us come out and plead and plead and plead over and over and over and over and over. But I think that, and I could be off just a small amount. This number is really 764,000 because it's really 52 point something percent. I think it's 52.8 or something percent. And so these numbers could be just slightly off, but they're not much off. These are the real deal. So at the end of the day, we've got to make a decision, West Virginia. If we can spend X number of dollars and we can truly bring in all these young people and we can really get them, vaccinated, explain this to me. Is my job not to stop the deaths? Is my job not to stop the hospitalizations? What is that costing us in West Virginia? It is unbelievable what that is costing us. We have these dollars available. We have moved all along. All along, we have moved. Now, I'm sure there'll be those that'll be out there in the wilderness that'll be criticizing and everything else. But you know what? At the end of the day, when it really boils right down to it, if I sit here weeks and weeks and weeks and weeks to come, our economy will suffer, and over and over and over, we'll lose more and more and more good folks. It's our time, West Virginia, to move again. Now, in addition to doing this, hold tight with me just one second. Well, I hope in addition to doing this, these were the recommendations that came to me. One of them is increasing access, taking the vaccine to the unvaccinated, and doing so with tents and visibility and fixed, tent sites and mobile vehicles. Going to our fairs, our festivals, church parking lots, sporting events, state, national, and county parks, bars, restaurants, and shopping areas. Offer the vaccine to those by using other agencies like Meals on Wheels. There's other things, that would incentivize vaccination that lots of people are doing. Establish some level of weekly drawings or monthly drawings and have a grand prize, whatever it may be, to all those that are vaccinated. We may very well do that as well. Set up highly visible COVID vaccine stations at every school. You got to do more than that. You are going to have to just do more than that. At our hospitals and health care, vaccinate the patients on discharge. Move messaging through primary care providers, primary care clinics, and educate doctors. Opening up vaccine availability, administration to provider, practices, offices, and locations. Encourage physicians and medical professionals to engage with other local community clubs and organizations to push the vaccine message. Now, from the standpoint of the focus on communication and strategies there being, we need to move from our older population to our younger population. We need to target certain levels of social media, whether it be TikTok or Instagram or Snapchat or whatever it may be be able to target our younger folks. We need to use Everbridge and our medical lab insights from WVU and all the WVU experts. We need to create a visible and consistent appearance wrap and identification for COVID vaccine sites, including the individuals that we use. You see, an entire marketing plan. We need to increase the mobile clinics and involve local EMS to enhance vaccination, maybe even have to go door to door. We need to possibly look at paying pharmacies to stay open later and to turn our local vaccine coordination into a school service projects. We need to turn local vaccine coordination into school service projects. There's lots and lots of good ideas here. But I am telling you, we need to kickstart this and kickstart this in a big way. We may be the first state. Now, lots of states are doing little giz-whizzes and everything to motivate and try to get folks involved. I am a real believer. I am a real believer through and through. Whether you believe it or don't believe it, I don't really care. I'm a believer just how great this country is and how absolutely wonderful West Virginia is. I am a real believer that our young people get so distracted and moving in so many different directions now that maybe just a real dose of patriotism from the standpoint of a savings bond, it may just key a thought. And really and truly, that would be meaningful to me. I would so much rather do that than just some incentive plan that's off the shelf. So nevertheless, that's what we're going to do. I would encourage all of you to really, really help me. Now, in all of this, let me just say just this. Our medical experts are going to tell you over and over, and they're going to probably do it today as well, just how safe these vaccines are. They're safe beyond belief. They're safe in every way beyond absolute belief. They're also going to tell you, and I'm speaking to the kids now, really and truly, I hate to say it, but if you're under 35 years of age, to me, you're still a kid in many ways. Now, I know you're terribly productive in your life and you're doing great stuff and everything, and I'm really proud of you. But you have so much life and so much wisdom to obtain. In lots and lots and lots of ways, I feel like, well, Jim, you're still just a kid. And I feel that way. But I know this. I know from age 35 to now where I am today, and tomorrow is my birthday, believe it or not. 70 years old. Gosh, how time has gone and how much I've learned. And so with all of that, I wish all of our people that are 16 to 35 all the great years of life in front of them. Our medical experts are going to tell you just exactly this. There is plenty of data out there that you can get this thing, and you may not even get sick, but you may end up with some level of side effect going forward in your life that will haunt you for many days. Maybe you won't. Maybe you won't. Think about the downside of the vaccination. It's next to nothing. Now, we got to have you. And I want to place in your hand a certificate that is a savings bond that is your part of stepping up. A certificate that basically is telling you how much you mean to West Virginia, how much you mean to your grandparents and your parents and all those that you're intermingling with and transmitting something that you may not even know you got. So please step up. Right now, step up. My message to you will be a little bit of patriotism, which is great for all of us at all times, and you will be doing something that will be a benefit like nobody's business. If you step up in masses, we'll be done. We'll be done real soon. And we'll be the first state that gets there. The first state that's just like we have been over and over and over, that's led the way and led the way and led the way. So with all that, I got to go back now and I got to go through the rest of all of our stuff. So I'm gonna do that, and I hope you really enjoyed me getting going in a lot of different directions there and grabbing a permanent marker and all the way across my thing. So that doesn't surprise me, to tell you the truth about me. At our state basketball tournament that's getting ready to start, the SSA, no, the Charleston folks, with Dr. Sherry Young in the Charleston, the Kanawha Charleston Health Department is going to set up there, and anyone that is 16 years of age, and older that is attending the state basketball tournament can get your shots right there. What we'll do is we'll take all your information and we'll be mailing you your savings bond, and you'll get it very, very promptly. So nevertheless, I thank Dr. Sherry Young and the Kanawha Charleston Health Department. Great work. I really appreciate you stepping up and doing that. We're at 82.7% of our total administration rate for first and second round doses. We're still absolutely probably right at the top or leading the nation in second round doses, but what we've done is we have stalled because we absolutely got to the wall faster than anybody else because we stepped up and we got shots in arms. Now we've got to cross the wall. Now it's time to cross the wall. We have over a third of our population has been fully vaccinated. We're at over 2/3 of West Virginia residents that are age 65 and older have been fully vaccinated. We're at 52% that have received one dose. We know they'll get the second dose and everything, but 40.9 have gotten first and second doses. We're over 78.3% of those that are 65 years of age. We're trying to get to 85%. Boy, that's a great number, but we can do it. Let's get there to 85. As far as our saving our wisdom people, our folks 65 and older, we now have administered vaccinations of 483,000. That's first and second shots total. Again, we want to continue to work really hard. We're at 78.3, and we're really, really pushing hard to get to 85. As far as vaccinating, from the standpoint of our businesses and our churches, all you got to do is call us and we'll come running there. The vaccine info line is up, vaccine reminders over and over. I tell you, your best defense right now is wearing this mask, but God knows we all want rid of that mask. You got to just help me. And the young people are the key. We want to continue to vaccinate all of our elderly without any question, but the young people are our key right now. We got to get over the hump. We ran to the wall. We got to the wall faster than anybody got to the wall and getting our folks vaccinated. Now we're leading the way, with first and second doses together. But now, to get over the wall, we got to make a move. We got to make a move, and that's what we're doing with our young Our testing, has gone really well. We've still got plenty of testing we still need to be able to do. Your free testing maps up. We thank Pruitt and we thank Walgreens over and over for all the great work they've done. We have 12 outbreaks in our long-term care facilities. Remember, that got down to 1. We have 5 outbreaks in our churches in 4 counties. That's Berkeley, Grant, Greenbrier, and Nicholas County. We need our church community to continue to step up. They've done marvelous. I congratulate them 1,000 times over. On Friday, we had 111 inmate cases. Now we've got 66. What a job corrections have done. And, I just salute them in every way, every way. Starting with the top at Jeff Sandy, right on down through everybody, but what an incredible, Betsy and everybody. I mean, it's amazing. It's just amazing what you've done. But we have 37 at Southern Regional and 11 at Eastern Regional and 10 at North Central. Good stuff. All the guidelines are up. You still got to continue to wear this face covering in our public places and everything. We're not long away from being done with this. Just hang with me just a little teeny bit longer and absolutely consider giving blood. And we'll come out a little bit, we'll come out probably on Wednesday with some more concrete things that how we're moving and what we're beginning to do. But, as far as things like, how we're going to do with our mobile units and where we're going to be and all that kind of stuff, and where all of our fairs and festivals and everything that we're doing. We're going to have to refine this just a little bit more. But the one thing I wanted to get across today is our jump start on trying to, beat 588 bad. Beat 588 ... bad. And if we can do that, the people that we need to have do that and step up right out of the get-go are our young folks, and I know they're going to do it, and we're going to have some fun with this, and if we can get there, boy, I'll tell you, it'll be a great day. Our young folks should really, really, really be proud of themselves if they'll help us step up, because you got a lot of people out there that love to get rid of these masks. And a lot of people, and I'll tell you, you got a big guy sitting right here that would love to stop coming in here and reading 15 or 13 or 20 or 8 or whatever it is names, because, we're probably not going to be completely rid of it, but boy, we could shut it down compared to where we are right now. Anyway, that's all I got. Thank you so much.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. And I think the governor has really said what I would want to say to the citizens of West Virginia very, very well. We are at a critical point in this pandemic response. It's been a long response. I think we're on day 409 of our leadership team's response with the governor. As the governor said, the key for us is having more people step up to choose to be vaccinated, to reduce the spread of COVID-19 and the COVID-19 variants in West Virginia, and also to make sure that we are protecting ourselves. And as we do that, by wearing a mask and staying physically distanced, and then choosing to be vaccinated, that we protect each other. So when we look at the number of cases, just as a quick review, in West Virginia, we have had 152,000 cases, and we have seen 2,821 great West Virginians who have passed with this COVID pandemic. And in contrast, we have seen 559,000 West Virginians be vaccinated with first and second doses. And we have seen 3 people die who have been fully vaccinated. And in the US, we've seen 32 million cases of COVID-19, and we have seen over 570,000 Americans die from this disease. And we have seen over 77 million people fully vaccinated with the COVID vaccines. And we have seen 74 people die who have been fully vaccinated. So these vaccines are incredibly effective. They're incredibly safe, as the governor said. We have followed now hundreds of millions of doses of these vaccines being given out in the US and around the world, and we see virtually no side effects from these at all, other than what people might experience as a sore arm, or maybe having a little bit of kind of malaise, not feeling great for a day or two after the vaccine. But these vaccines are over 90% safe in general, or over 90% effective, incredibly safe, and preventing deaths and preventing hospitalizations, as we talked about, almost 100% safe. Or I'm sorry, almost 100% effective. As we look at around the world, what we're finding is that different variants are causing states and countries to have a lot of problems. State of Michigan is finally seeing a slow reduction in number of cases, but they still are seeing people coming by the droves to the hospitals in Michigan, including more and more people who are younger and younger. The state of Washington now is starting to see its fourth wave. And when we look at countries like India, India has had over 1 million new cases in the last 3 days, and they are suffering so many deaths that it is hard for them culturally. They cremate bodies upon death, and it's been very difficult to keep up with this great number of people that are passing from COVID. And India is a country that doesn't have access to the vaccinations as much as we do. So it really is, as the governor said, it's a time for all of us to support each other, to run to the fire, to protect each other. And when we look at the number of variants in West Virginia, we have seen an update, and we now know that the United Kingdom variant is the most common form of COVID-19 in West Virginia. We have seen a total of 471 positive cases that have now been identified to be from the United Kingdom variant. The California variant, which is not as deadly, but does increase spread, we have seen a growth as well to 215 cases, and we still are 3 cases of the Brazilian variant and 2 cases of the South Africa variant. And what we're seeing is that the United Kingdom variant is spreading in the age group of people that the governor talked about, in the 10 to 35-year-old age group, and particularly in the 20 to 29-year-old age group is where we're seeing a lot of the spread. And so we really are both calling upon all of our residents at all ages who have not been vaccinated to consider being vaccinated, choosing to be vaccinated as soon as possible to protect yourself. But also by vaccinating people who are in these critical age groups, we slow down the spread and we slow down any more changes of these variants. Because if people are infected with these variants and can't respond immunologically, it gives the variants an opportunity to continue to mutate, and we end up with more and more and more deadlier forms of COVID-19. And that's what we're really concerned about around the world and in West Virginia. So ultimately, as the governor said, these vaccines are very safe. We've all been vaccinated. All of the people that we love the most in the world, for me, my wife, my mom, my daughter, who's 27 years old, my 2 sons are 25 and 21, have all chosen to be vaccinated. And I very much hope that each one of you who are watching or listening will too, and pass the message. We are all in this together. And the way that we have done so well is we have supported each other. We've loved each other. We have been altruistic in our goals of protecting ourselves so that we can protect each other. Thank you.
Thank you, Dr. Marsh. Next, we'll go to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good afternoon. First, Governor, I want to wish you an early happy 70th birthday. Maybe I'll just take tomorrow off since it's your birthday. No, actually, Governor, I'll be doing vaccines, I promise. Just to highlight a couple of things that the governor has talked about. He's given us a lot of flexibility to move out and do more things to get to people. and some things that have already occurred based on this initiative. This weekend at the WVU Blue and Gold game, there was a vaccine clinic set up, and happy to report that after the game, 16 additional athletes decided to take the vaccine that had been waiting to see if they were going to do it. We are now engaged, and the JIADF Joint Interagency Task Force is engaged with getting vaccines out to primary care providers, because we know that there are many people out there who, if they have the opportunity to talk with their primary care provider and understand the value of the vaccine, as Clay pointed out, they'll get the vaccine. The governor mentioned the SSAC. We're going to be partnered with the SSAC all the way through the end of the school year, and working not only to get those in spring sports, but also preparing those athletes for fall sports, because now is the time to get the vaccine. We have had a couple of really positive events with food banks, one in particular this weekend in Monongalia County, and thank Dr. Lee Smith and the Mon County Health Department for partnering with the food pantry up there. As the governor pointed out, we'll be working with state parks, national parks, county parks. We will go wherever we can get the opportunity to get vaccines and arms. The other thing I'd like to mention is you've seen, probably seen some things nationally about the number of people across the nation who are failing to go get their second dose in a timely manner. And as Clay points out, only after you get the second dose are you better protected against the variants. I'm happy to report that in West Virginia, as the governor pointed out, we are doing exceptionally well with West Virginians getting their second dose within the time frames and continuing to go and get that protection that they need. Thank you very much.
Thank you, sir. Next to Dr. Ainam Jad, our State Health Officer.
Good afternoon. As we continue for our data quality and assurance regarding our death reporting, our epidemiology team has done a death reverse match reviewing our COVID-19 deaths. And reviewing that, we did find 162 individuals that did not die from a COVID-related death. So, our early reporting is early reportings that we have. After reviewing the death certificates, they did find that 162 people who did pass away did not die of a COVID-related death. So we will be removing those numbers tomorrow on our dashboard. This is in review of our data that we have. So going over that information, our reporting system that we have is for real-time information so that we can do public action. But then once their death certificates do come across, they do not list COVID-19 as a death-related illness for their passing away. So that will be changed tomorrow. In addition, we continue to have our information for the electronic system. We are going to complete that by the end of this week so that we can have electronic death certificates available hopefully soon. Our legal team is reviewing those documents, but that's just a brief update for that. Thanks, Jordan.
Thanks, Dr. Amjad. Secretary Bill Crouch from the DHHR is also joining us and is available for questions. We'll now go to questions from members of the media. The first today from Kenny Bass with WCHS and Fox 11.
Hi, thanks for taking my question. A couple of real quick. One, is there a possibility we could add data to the DHHR website, or if the governor could add it in his briefing, about how many of the people who've passed away of the deaths that he recognizes were vaccinated or chose or did not get the vaccine for whatever reason? Is that a real-time thing? How long does that take to determine if someone who's passed away in West Virginia, whether we can determine they've taken the vaccine or not? And just briefly, I wanted to get Dr. Marsh's opinion, the governor's opinion, General Hoyer's opinion, perhaps, on the continuing situations in Florida and Texas. Now, we hear a lot about Michigan, and we hear a lot about India, obviously, that things are going pretty well. India declared victory over COVID earlier this year, and now we see what's going on. But Texas and Florida seem to be doing very well with very, very different ways of managing the vaccine than some other states have taken, managing the virus and the pandemic. So if you guys could weigh in on this stuff, I would greatly appreciate it. Thank you.
Dr. Amjad, you've got to do the first, and Dr. Marsh, you got to do the second one.
Yes, Governor. So, Kenny, there would be a time lag. I mean, I think given some time, we could probably pull that data together. I mean, that is one reason how, Clay does, he's able to say that we did have 3 deaths of people in the West Virginia who died after they've been fully vaccinated. But that also took us several weeks to pull together because, as you can imagine, we have to pull together all the data in the state of everyone who's been fully vaccinated. And then after someone passes away, we need that death certificate data. And that takes anywhere from 10 to 14 days to get to us. So I'm sure given some time, we would know of the people who have passed away. And as the governor does say, who has passed, we could. But then also, I don't know how much sensitive information that is to give out on such a briefing as well. But as far as that information, it could possibly be done, but it'll take a lot of time. So that is something we'd have to think about, the sensitivity of it and how much information we'd want to put out there. But it does take time to kind of pull all those resources together. Clay, I don't know if you had anything to add to them.
All I would say, Kenny, thank you for both of those questions, which are really good, is we will track that and we will keep up to date related to, the breakthrough cases we've had, which are people that test positive for COVID-19, despite being fully vaccinated and being the 2 weeks after the final vaccine. And so we'll track that. I think, as she said, tracking that in real time will be challenging, but we will share that with the folks on this call and with the citizens of our state. I would say the Florida and Texas question is tremendously interesting, and I am also very interested in that because, as you rightly point out, Florida has the most cases of the variant virus of the United Kingdom variant and doesn't seem to be doing nearly as poorly as Michigan has, which had the second highest number of the United Kingdom variant cases, and Texas similarly. My best thought is, and certainly I don't wish this on anybody, but if you look at when you see more spread, it's really when people are indoors together, particularly indoors, without doing the best mitigation measures with wearing masks and physically distancing and not being fully vaccinated. And I think that when you look at Florida and Texas, because their climates are much warmer than the Great Lakes climates or even here in West Virginia, that their time indoors actually might be the middle of the summer. So parenthetically, as opposed to, expecting more person-to-person indoor spread in the winter, which is what you see in the colder parts of our country, it may be well in the middle of the summer that places like Florida and Texas might have a lot more risk of spread because people go inside in air conditioning together when it gets really hot and humid there. But, as we have said all the time, Kenny, in this pandemic response, we are learning every day. And if you ask all the things that we've done right and the things that we haven't been able to anticipate, I would say the virus is well ahead of us. But because we are reacting very quickly and the governor has set up a team and a structure that can respond and learn from what we're seeing, I think it still will mean West Virginia should do relatively well in this pandemic. But trying to understand this virus has been a big chore.
All right, thank you, Kenny. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, you said the savings bonds would be paid for out of our CARES funds. Do we have an overall number of how much of the CARES funds we're going to be dedicating to this? And then second, why not just give people cash? Wouldn't that be a better incentive than a savings bond that you have to wait on to mature? Thank you.
Well, Charles, it may be at the end of the day, because we've got to get through all the hoops to be able to give this many savings bonds, and it may be at the end of the day that we've got to flip this back a little bit, from the standpoint of maybe we won't be able to give everybody savings bonds, but I would really like to see us be able to do that. And the reason I'd like to see us be able to do that is just what I've already said. Just the fact that these people, you know, $100 will get gone just like that, you know, but, you know, with our younger people and everything, you know, I want them to really see and understand that they've done something that's really meaningful. It is not just, you know, a dash in the pan and a couple trips to Wendy's with your friends and everything. This is something that they're doing that is a real contribution to all of us that's going to save a bunch of lives. Not only can it really help them with any potential possible side effects or whatever like that, and God forbid and everything, but at the same time, it is a way for them to step up and really do something great for our state and our nation, and especially all their loved ones, you know, that are around that they could be infecting, and just doing the great work that they're doing. You know, from the standpoint that, you know, the dollars of CARES money, you know, these are, we've gone back and we've looked at the possibility of the deep dive dollars or buckets that we had, you know, where we had some older CARES money and everything that we could use. And Charles, I'm very hopeful that the more the better. You know, in my number of 275,000, if we were to truly get 275,000, that's $27.5 million. And it sounds like an enormous number, does it not? But Charles, think about this. Think about just how much the testing cost. You know, when I read a thing here, it says, you know, 289 new positive cases today. That 289 positive, wonder how many tests that we did to get 289 positive. If we did 4,000, and surely we did 4,000, we may have done a great amount more than 4,000. For all practical purposes, Charles, that one day in testing is landing somewhere close to $400,000 a day, you know. Now, and if we tested 13,000, then we're landing somewhere close to $1,300,000 a day on just the testing. We're not talking about all the hospitalizations and all the deaths and all the pain to our economy and everything else. Charles, it's an enormous number, and it moves very, very, very quickly. It's hard to sit here and think of $27.5 million if we got all 275,000 tested or vaccinated. You know, it's hard to imagine that we're going to give savings bonds to 275,000 people. $100 a pop is $27.5 million. Now, but if we did that, Charles, it would be the best money ever spent like you can't imagine. If we don't do that, just think what we're spending every day on testing. Just think about this number, Charles. You know, from the standpoint of the old CARES money, $74,100,000 on testing. $74,100,000. You know, Charles, I hope to goodness that we exceed 275,000, and we've got to absolutely pay a little more than $27.5 million. Nothing would make me happier. Nothing would make me happier.
All right, thank you, Charles. Next to Mark Curtis with Next Star Media.
Good afternoon, Governor, and everyone. And since we don't have a briefing tomorrow, happy birthday, Governor. Enjoy your 70th. I guess you and I are fellow Taurus. I'm catching up to you. I'll be 62 in 3 weeks, so God bless you. Real quick, Governor, if you could address what you plan to do with the transgender student-athlete bill this week, and then to General Hoyer, if you could address, we're out doing a story today at a local pharmacy, General, where they have 70 doses of vaccine. If they don't get that into arms by tomorrow, it will expire and they'll have to toss it out. How serious of a problem is that statewide with vaccines expiring, and what are your concerns about good vaccines not getting used?
Mark, let me touch on both real quick, okay? And then if the general wants to jump in, he can too. Mark, in all honesty, with the vials, with 6 doses in the vial, you know, and all of a sudden a hospital is discharging 2 patients and they don't have anybody else to give them to. you know, we have been in a situation to where what we have done is we have been so stingy with our vaccines, and we've wasted almost nothing. That really and truly, you know, Mark, at the end of the day, with the number of vaccine supply that we have right now, we really need to move. And from the standpoint of the possibility of us, we'll try so hard to not ever waste one. But Mark, the real truth of the matter is, we will waste some. That's all there is to it. It's the only way that we can for sure get there right now. You know, now, on top of all that, Mark, you know, I've lost your first question. What was your first question again? Oh, on the transgender stuff. You know, yep. Mark, I thought about this in the beginning, you know. In the beginning, I thought, well, you know, I'm all in as far as middle schools and high schools. I'm absolutely all in, because I do not think that from the standpoint of our girls that we ought to allow a situation to where, you know, for whatever reason may be, we end up with a superior athlete that could just knock our girls right out of the competition. And so with all that being said, I was absolutely all in from the standpoint of our middle schools and our high schools. And then I thought, well, you know, the NCAA is going to be so liberal, and they're going to be, you know, over the top and everything. And I hated in the beginning in some ways that we moved that way and included our colleges, because I thought, you know, we're going to be in a situation, sure as I know my name, that you know, that what's going to happen here is we're going to miss a lot of opportunities with our colleges here in West Virginia. We're having our attorneys continue to review every aspect of the whole thing, and they'll advise and everything. So I can't tell you positively what I'm going to do, but right now, Mark, if I have to make a decision, veto, sign the bill, or let it go to law, I'm going to sign it. And I'm going to sign it proudly, because I really believe that that's the right thing to do.
All right, thank you, Mark. Next to Paul Mullen with WCBC. Paul, I think you may be muted. It looks like we're having some trouble connecting. Let's go to Kelsey Soto with WSAZ.
Good afternoon, Governor. Kelsey Soto, WSAZ. I'm out here in Mingo County, one of the least vaccinated counties in the state. And we've just been talking to residents about the hesitancy here and what's the holdup. I know you talked about some of the incentives. Is there any efforts to work on education out in this area? Have we started reallocating doses elsewhere? Because Mingo County is sitting in the low 20% for vaccination. It seems like even 50% is going to be a stretch here. Just talk about some of these rural communities seem to be the ones that are having the hardest time moving these doses.
Kelsey, that's where we need you. You know, in all honesty, that's where we need our media to really step up and help out too. You know, Kelsey, I get on here and you have every one of our experts that are saying we've had 558,785 people that have been fully vaccinated in West Virginia now. 558,785, and we've lost three. You know, so with all that and everything, Kelsey, we need you reporting that, because that's the education. Right there's the education. In our nation, I think 77 million people have been vaccinated, and we've lost 74 or some number like that. You know, really and truly, we're trying in every way with General Hoyer and Dr. Marsh and myself and Dr. Amjad and everybody and every, you know, Secretary Crouch, everybody in every way, but Chelsea, you know, Kelsey, just listen just to one thing, and that's just this, is all of us, Jim Justice, your governor, Dr. Marsh, your coronavirus czar, all of our media, All of us need to be reporting the facts, the real facts, exactly what's going on, because you need to be absolutely part of the solution and in no way part of the problem in the education process for those folks in Mingo County and all across the state, because people are scared. People get scared. And when they get scared, you know what they do? A percentage of them end up in a body bag. That's what happens, Kelsey. And, so we need you. We really, really need you, in every way. We need you to get to all the young people, to tell the young people about my offer of this $100 savings bond. We need to get to the young people to tell them what a patriotic move it'll be for them to get vaccinated, and how it could very well save their life. It could affect them from a side effects way, that it could help them there. And not only that, it may save their parents or their grandparents or whomever it may be. Kelsey, we need you. We really do. We need you more than you'll ever know.
All right, thank you, Kelsey. Next, we'll go to June Leffler with West Virginia Public Broadcasting.
Hello. Thank you for taking my question. So this is coming from a listener who said that when she was vaccinated, she received the opportunity to report any after effects through V-Safe. And she was asking if this is still available to everyone being vaccinated. Just wondering if you could tell us a little bit more about V-Safe and efforts to document any after effects.
Maybe Dr. Amjad or Bill, one of y'all, can help June with this one.
June, yes, so that's just an online tool that a person who's been vaccinated can report their side effects, and so that can help get that information to the CDC, but those are still available. But we also want to encourage people to contact the place where they got vaccinated, because we also need to report any major side effects. But V-Safe is an online tool where you can report yourself side effects quicker for data collection, but we want to remind people to call where they've gotten vaccinated as well for any major side effects. So.
All right, thanks, June. Next to Paul Mullen with WCBC.
Good afternoon, Governor, and happy birthday to you. I hope you can advise when you are having cake so we can have the fire department on standby. I'd also like to ask a question of General Hoyer. Many of those that have not been vaccinated have a trepidation against getting the Johnson & Johnson, and they may need some assurances that they could opt for a different vaccine, and you may be able to get more people out there if they don't have that fear. Are you making arrangements for that, or are we still in you're going to get what you get?
General Hoyer, that's your question, but before you go, Paul, I loved your comment. I loved it, and you're probably right. We may need more than a fire hose with 70 candles, but I can't believe it. But no, Paul, I love the humor. I love when we take time to tease one another. I really believe the good Lord gave us the ability to smile and to laugh, and I love when people are jabbing me a little bit. That's really good stuff. And so thank you for your question, Paul, in general. And thank you, Paul, for all you do every day. But General, if you could take that, please.
Yes, sir, Governor. Paul, based on the availability of vaccines now across the state, if someone does not want the Johnson & Johnson vaccine, Pfizer and Moderna doses are available. Obviously, for 16-year-olds and above, or at 16, we do have to focus on the Pfizer, and as they open up 12 to 15-year-olds, that'll be Pfizer as well. But if someone has a particular concern about Johnson & Johnson, there are plenty of the other doses available across the state of West Virginia. If they are having an issue with getting to one of those doses, call the hotline number and we will help them get to the dose that they prefer.
All right, thank you, Paul. Governor, I'll turn it back to you.
No, General, I loved that answer. That was a great answer and everything. I hope everyone understands, that we're going to accommodate our folks and everything in every way. And Now, we've all got to just remember just this, and I'll make this short and really sweet. But, you know, we have gotten where we've gotten to by pulling the rope together. That's all of us. That's everybody. That's all West Virginians. That's all of our politicians. That's all of our media. We need to pull the rope together like you can't imagine. I always say the steepest part of the mountain's right at the top. That's where we are. We got to get across. I'm doing my part by stepping up and trying to find ways to get our young people to the table and do something that I think is really the best we could possibly do. I want to qualify now. You know, if from Treasury and everything I can't get this many savings bonds, then I'll just have to ask the people, would they rather have the cash or would they rather have the bond? But nevertheless, I hope they'll that I'll be able to get as many savings bonds in the hands of our kids and our young people as I possibly can. But more than anything, you just got to know I am a mathematician. You know, I'll screw up a word every now and then or not remember somebody's name, but I absolutely am a mathematician. And so all you've got to do is step back and look at the total eligibility of the population and say from that, we've got 588,000 folks that could possibly not take this vaccine. That's what we've got to beat, 588, and we've got to beat it bad. And as soon as we beat it bad, we're going to be at a percentage level that gives us these immunities that we've been looking for, gets us out of this mask, absolutely does so much good for West Virginia as far as our economy, all the health and safety of our people, the hospitalizations, all the different things, and more than anything, maybe, just maybe, and I can't guarantee this, we know that, because this thing is fluid and it turns and it bites us all the time. But I can hope and pray that on the numbers and the experts and everything that I have to go by, it'll make us count less body bags. This is one tough go for lots and lots of folks. But I'm telling you, from my standpoint, coming to you day after day after day and reading name after name after name after name is really, really, really tough. 2,821 people have died. It is tragic beyond belief. We got to stop it. We're right there, right now. Absolutely, $27 million would be a gigantic price tag. But really and truly, it would be so minuscule in comparison to where we've been, what we will continue to have to do, how much more suffering we'll go through, how many more hospitalizations, how many more deaths, how many more absolutely catastrophic things to our businesses. Absolutely. It is my job to get us over the top of the mountain. That's what I'm trying to do. Thank you so much. Let's pull the rope. We've got to pull it together, everybody. Thank y'all.